As I say, this is a series of 3 webinars, but it doesn't. If you didn't attend the first one, it doesn't matter. Each webinar stands on its own as well. It's all in context. We're discussing different aspects of iPlanet. So we started with introduction to iPlanet and referrals. Today we're going to be looking at plans, outcomes, reviews, notes and logs, and tasks as well. So really the operation aspect of iPlanet, where support workers interact with the people they support through plans and outcomes and so on. So kind of the real mechanics of it. We're going to touch on KPIs a little bit just to show you where some of the information goes. But the next webinar, which is on April 24th, that really goes into the management and senior management aspect of iPlanet. So do sign up for that, because that's really about kind of reports and evidencing. And then we also touch on incident management and risk in that webinar too. Okay, so very briefly, you might have seen this slide from last time, but we've got 1 or 2 slides which are the same, and then we'll get on with what we're talking about today. But if you've not seen iPlanet before, it's a flexible and modular cloud-based system. So it's on the internet. It's designed to help plan and record all types of support. So it originally started back in 2009-10, specifically focusing on support around people with learning disabilities. That footprint has significantly expanded over the last few years as the principles of iPlanet and its functionality and its footprint has expanded into all sorts of different support types and support needs as we've worked with more and more providers. So we support providers across the globe: New Zealand, Australia, the UK, Ireland, and we've got thousands of supporters and service leaders across the world, helping them deliver on the promise of the people they support, which is, improve their lives, keep them safe from unnecessary risk, and offer appropriate transparency to their loved ones. So iPlanet is the tool for that. So we really like to think of iPlanet as a tool that helps providers really reach their potential. Which we might not have time to cover today, but people supported can also access iPlanet. They have a side of iPlanet that they can access and look at. So here we're talking about the values of iPlanet and how these underpin the authenticity and person-centeredness. So iPlanet really offers value in terms of evidence and value, so the evidence that you can capture around outcomes and support delivery, which we're going to touch on today. Inclusion, because people supported can access iPlanet, their family can access it, which leads on to transparency, which is also is transparency within the organization, so the support team can really come together as they share more and more information, but also across different services as well. And then ultimately accountability, making sure things that we say are going to be done get done. So there is a dashboard, there is measuring impact, KPIs, tracking outcomes. So the tracking outcomes is the aspect we're going to look at today. And the point we're making today is how the values approach that iPlanet offers, that system can really underpin values. So we sometimes think of online systems as a bit cold or something that is just tick box exercises, but the iPlanet system really is based on values. So hopefully you'll have a look at that today. So this is just a quick overview or a bird's eye view of what the iPlanet system looks like in very simple terms. So the circle in the middle is notes, plans, document management workflow, and so on. That is the core iPlanet. So that's when you roll iPlanet out in your organization. This is what is included in every iPlanet package. And all of that is very, very configurable to how you work. So for example, plans in that circle towards the top right, they're configurable to how your organization operates and uses plans for support. And then on the outside circle are the modules or the add-ons, so the things that you want to add to your iPlanet package. So it might be particular needs you have, so it could be the needs assessment or referrals, which is what we covered in the last webinar. And then other modules could include clinical care planning, support tasks, which we're going to look at today, funding, and so on. So people generally, or so providers generally roll out obviously the core iPlanet and configure that to how they work. And then they may take on 1 or 2 modules around that to solve particular needs that they have right now. But we're in the last webinar we touched on referrals and needs assessments, and that kind of what it means to get somebody onto the iplanit system and all the benefits of that just by having all their information in one place and have that feed from referral through to needs assessments. Today we're going to quickly look at plans and outcomes, which touches on key performance indicators. So we're going to get a little bit of a tour about that aspect of iplanit today as we kind of flow through that whole system approach. And just to reiterate, the system is configurable across all the settings. So it's very important when we deliver training for iplanit, for example, that the staff recognize their plans and they recognize the language as well. So language really varies across different providers because language really comes from what your values set is. And we make sure iplanit reflects that. So there's lots of configurability around changing the language and the plan settings and so on. Hopefully will make a bit more sense when we have a look at the system. Now, thinking about what we're going to look at today is we're going to look at support tasks and outcomes and the difference between the two, but also reviews, support records, notes and logs, keeping plans up to date and relevant, and communication about those outcomes. Now, on paper or in some systems, these things can be very, very different tasks. So we tend to put them in order of importance and urgency. So, for example, support tasks, things like personal care and meal preparation and so on, they could be really, really important and really, really urgent. Whereas setting outcomes or tracking those outcomes or finding out whether those outcomes have happened or not, they're important, but they can be less urgent, and sometimes they can be put on the back burner, only looked at during reviews. And reviews which have long deadlines, they become less important, although they're urgent because you need to do them. What I'm showing you here is that workloads can sometimes be placed into these kind of categories, and the danger is that we end up just staying in the important and urgent quadrant there, where we're just doing support tasks and records, and that can really mean that we're just keeping the person we support busy. Whereas the bigger goals like the outcomes and the long-term planning, that can sometimes, because it's less urgent, although we all recognise its importance, because it's less urgent, it sometimes gets put on the back burner and it doesn't get the attention it needs. What iplanit does is it pulls all of these together and puts them in the same space so that you can work on all of them just as conveniently. And that's what I'm going to show you today. When we look at a plan, we're going to look at how easy it is to record the tasks that need doing, but also how easy it is to set outcomes and track them and say that things have been done or not, and also the reviews. So what I'm saying here is the danger of support is that we always just deal with what's urgent, not necessarily what's important in the long term. And iplanit, it really does pull all these things together, so you're constantly interacting with both the important things, the urgent things, and the long-term things as well that are important in support. It does this by having a really, really unique architecture that is different from all of the systems that are on the market at the moment. So on the left there, we have a traditional forms-based support plan. So that could be paper-based or it could be on a computer system. And what other systems tend to do is that you fill in a form, and it's an isolated form, and it says, yes, there is a support plan, and yes, there is a risk assessment, or yes, there is a needs assessment, and there are outcomes set, and there is a budget and so on, and there are things that need to be recorded day to day. But all of these things are siloed or disconnected. So firstly, there's a little bit of repetition. Secondly, the architecture of the system is usually around staff as a resource, whereas on the right-hand side, we have the iplanit kind of granular component-based approach, which puts the person at the center of the plan. And because the person is at the center of the plan, the architecture of the system allows it to be a lot more dynamic. So there's less repetition. The person is the focus, not the staff member or the support availability. And that really feeds into much larger reports and much more informed reports. So rather than plan counting, we can really dig deeper into what plans are there, what's on those plans, how those plans are being completed across different areas on a person-to-person basis or on a location basis. So having a different architecture in a system can really, really be important. So on the left, it's forms, whereas on the right, iplanit, it's a dynamic system. It connects everything together, which is what that diagram is there showing. So it's the database design with the person, not the staff member at the center, So this is quite a colourful and what looks a little bit complicated, but it's a really simple, although it's very busy, it's really, really simple. This blue box at the bottom is the operations of the staff. This is the direct support workers and their managers. These are the tools they can use to organise their support. So number one is the person's plan, and an outcome can come from that. We can set outcomes directly from the plan, or we can, on the number two towards the right, we can set outcomes on their own. Each outcome can be broken down into steps, smaller steps to help towards the larger outcome. Those are actions. And then the blue diamonds, these are the notes, the communication notes staff can make and share with each other about progress. And that really is how simple the system is. But what is happening also is as we move up into that top box, that orange box, all of this is constantly creating reports. So on the left, number 5 on the left there, it says that you can get different reports about different types of plans, how they're being completed, what are the popular sections of the plan, the risk assessment stats, plan reviews, how people, whether reviews are being done on time, or if they're late, why they're late. And then moving towards the right, the key performance indicators, whether they're your own internal provider key performance indicators, or whether they are central government or local government key performance indicators. You can link up the outcomes to that, so it will automatically create reports. And with this, a large selection of reports helps organizations with their strategy then, and also to evidence what's being done. So that instantaneous feed of constant data informs leadership, provides evidence, and shows progress. So they're the two parts. So we're going to focus today in that blue part down there, the actual tools that the staff are going to use to help organize their support. And the next webinar really touches on the top box, the yellow box at the top, where we're looking at how that feeds in. But we'll touch on it today for context, but the next webinar will really go into detail.